course, we had one yesterday, so if you are returning, we welcome you, and I hope that you come with more questions. I know that we think about things a lot after the fact, and Dr. Young, she shared a lot of great information with us. And for those of you who are new and this is your first session, I want you to know that Dr. Young plans to share with you the information that they had yesterday, and you may have a little bit spin on it as she shared earlier today. I also want to talk about just the purpose of us doing these sessions. So we have about 6 or 7 lined up to talk about things all related to grant writing and preparing your proposal for the RFP that will be released in June for EHE. So there are going to be topics related to evaluation and budgeting. There are going to be topics related to leadership training, boards, and all things that's relevant to just strengthening your nonprofit organization along with strengthening that proposal. So today is going to be a high-level highlight of each of those topics. And then at the end, Dr. Young will just open it up for questions and answers. And we want you all to be able to have conversation with her and ask her those hard questions that you probably didn't feel comfortable to ask before today, or in a different setting that may have been similar to what we are sharing with you all right now. And I also just want to end with, at the end of the session, we will send out a recording of either this session or yesterday's session, depending on what is best, along with the resources that Dr. Young has provided for us on yesterday. So I hope you all enjoy. And again, if you have any questions, you can place it in the chat box. Sherry and I will monitor it. Dr. Young has done a great job at monitoring it herself. And then also, some of you have my number. You can text me or email me. We'll be glad to ask those questions for you. And at the end, feel free to unmute yourself and have that open discussion with her. So thank you. And I'll give it back to you, Dr. Young.
Thank you. Am I able to share yet, Sherry?
Yes, ma'am. Just one second.
Okay. Well, welcome back to the people who are coming back. I hope I won't bore you today. So we'll see what we can do.
There we go.
All right. Okay, so now you can see the slide, I trust, and we're going to talk about responding to the request for proposal. And as I shared yesterday, I deeply regret that it's not available yet. So if it had been available, we would have gone through the entire thing in a very different way. But we're going to touch on all the salient points. And Eddie Wiley assured me that we did cover the salient points. So that helps a lot. And I do welcome your participation in the chat, and you can always get back to me if for some reason I don't get to you. But right now, today, as with yesterday, this presentation is really food for thought, some additional tools and resources for those of you who have the experience, and some missing pieces of the puzzle that maybe perhaps someone may not have thought about in the past. It isn't a recipe for a guaranteed grant or the keys to the kingdom, but we hopefully will get you closer there. Now, before writing the response, we urge that everybody do homework. And you know, if you don't like the word homework, you can just say, oh, it's my home play. So how to do the homework? Obviously, when we get the proposal, the RFP, we'll have to read it with great care, looking at all the requirements to make sure we do fulfill the requirements. The format's important. Sometimes people will just ignore your application if you don't follow the format. The process is very important. So that goes from the submission to whatever is required as a follow-up. And then please pay attention to the deadline, because, you know, if we miss the deadline, we've missed a golden opportunity perhaps. And then really important for smaller organizations in particular, look to see when you'll be getting the payments for your work. That can be a little bit challenging sometimes for organizations who are small. And we'll talk about that a little bit more. So here's your competition for the general nonprofit community at large from the most recent data that I could pull. And so you can see that we have in excess of 11,000 nonprofits that are registered in our community, just for Memphis, and greater than 13,000 in Shelby County. And if we go to the metro area, 15,000. You can see the income total for the organizations. Based on that, there are people who are saying, hey, if we're spending 12 to 13 to 14 billion dollars in nonprofits, why isn't everybody being served in a unique and special way? And so we have to look at that. Now, when we look at local agencies that are HIV service providers, according to the End HIV 901 site, and some of these may be duplicated, but we have at least 40 providers who are addressing care and treatment, 40 who do testing, 23 that provide prevention services, and 20 that provide support services. I added another category because there are so many things that you address in the End HIV 901 site with that address the determinants. So for those of you who may have been on the Zoom yesterday or today, can you think of some other miscellaneous things that we really deserve to address if we're going to talk about ending the HIV epidemic in our community? Anybody? Don't be shy.
Yes, I can think of one maybe, and it might fall under care. However, housing is a
Yes.
big issue.
Yes. Thank you for saying that, Kim, because, with housing, whether it's with HIV or any other illness, if we're not in safe housing, if we're not in housing that we can afford, think of all the stressors that puts us under. So, we know that in order to be successful with care and treatment, in order to be successful even with prevention and other support services, housing is so critical and important. So it's great to be thinking about those types of things as you think about your role in ending the HIV epidemic. So here's what a funder sees. Funders see people competing for finite dollars. So whether we like it or not, even though you saw those 12 to 14 billion dollars worth of income to the nonprofits, you know what? It's still a finite sum of money. And so here's what what a applicant sees, right? Applicants say, oh, I'm going to get all this money. There's $2.5 million coming to the community. Oh, it's going to be like going to the ATM. Oh, I won the lottery if I can get this grant. Oh, it's a great Christmas present. Well, somewhere between the two perspectives is the truth. So you want to know, okay, great, but how does my nonprofit get a piece of this pie? So the question becomes, what pie? It's only $2.5 million. $2.5 million is a huge amount of money. And I'd love to have that in my bank account. I just don't. I wish it did. But, it's still a lot of money. But when we break it down in a different way, it's not very much money. Now, before I thought there were about 6,500 cases of people living with AIDS in our community. But you know what? I was told yesterday it's probably closer to 6,700. That means if we took all the money that the state says they're going to give us for the RFP and divided it up among the 6,700 individuals, that would only be $375 about per person. Now, we can't do very much with that. So if we do the math, it just won't work. But there's another way of doing the math. If it's true and accurate that we have about 40 providers that serve individuals living with AIDS, and let's say on the average, each one of those organizations has 5 employees, each employee could adopt a caseload of about 33 patients. apiece. And people would say, if we really case managed perfectly 33 people a year, what could we do? So when we do the math, and as we respond to the RFP, we're going to have to be thinking creatively, right? Because even though that sounds like a lot of money, we have a system in which to work in order to make sure that we can be successful in ending the HIV epidemic. So in one chart, and this is from the End HIV 901 plan and presentation, we're allowed to look at Arkansas, Tennessee, and Mississippi as our target area because of how healthcare systems work and how we work, play, and live in our community. And so this chart is also the target, the transitional grant area that was provided. And this is from that chart. So this looks at newly diagnosed individuals. So we need to be familiar with all the data that's out there. There's a significant amount of data in that 69-page report that's on the web. So if you are tasked with the job of writing the response, please be familiar with that information, because sometimes, as we do our day-to-day work, we're not privy to all of the information out there that would be helpful to us in responding to a grant. So the planning groups are Tipton, Shelby, and Fayette. So you can already see that that's a little bit different than this target transitional grant area, right? But all of you who have been part of the working group understand the intent of this configuration in terms of what target area we can assume, and then what's involved in the partnerships. And so I'm sure that there's some Hardeman County stuff that comes into Fayette and some Haywood County that comes into Tipton, as well as Lauderdale. But I'm sure that we are working on those as people cross county lines. So in order for us to accomplish all this, we're going to need partners, right? Because there's no way any one agency can do it all unless we're very, very unique. And if there's somebody out there who's very, very unique, I just want to meet you because we can all learn from you. Okay, so here's some basic questions to ask ourselves if we're doing the response to the proposal. Do we meet the eligibility criteria? So you've been part of the planning group, or maybe not, or maybe you're just new to the planning group or peripheral to it. Eligibility criteria will be spelled out. Do you have the capacity? And we have to look at your leadership. Aisha was sharing that she just has additional responsibilities, for example, because the prior supervisor in her area just went to take another role. So she's having to juggle more than her usual set of responsibilities. Although she's extremely capable and does it well, would this be the time for her, for example, to take on a major, huge grant initiative? So that would be a question that each one of us in our organizations would need to answer for ourselves. Do we have the staff? If we envision something creative and something innovative, do we have the right staff? It may be a great idea, but do we have the staff that we can call on to execute that idea? Staff's pretty remarkable. They will rise to occasions that you don't dream that they're capable of, but we have to at least have the discussion and make sure that we're challenging the gifts that they have. So do we have the technology? The pandemic, if anything, showed us that many of us do not have adequate technology to compete effectively in this environment. And what other resources? We'll be talking about some tools to look at other resources and challenge ourselves to find out if we have those resources. And then, will you need to partner? Now, from the looks of the amount of money, from the looks of the area we have to cover, in spite of 6,700 actually being a lower number compared to many other numbers, They are very critical numbers. And so we'll have to think about who's the right partner or who are the right partners. Another question to ask is, in the capacity field, what kind of income do I have as a nonprofit? So if we're asking ourselves, all right, we're going to ask for $500,000. You might not get approval if you're a standalone agency and you're only filing a 990N. A 990N, for those of you who may not know, are for organizations that have receipts of $50,000 or less. And then you have the 990EZ. So you look at the kinds of things that you have coming in so that you know what type and size of grants you can accept. And we'll talk about that in a little bit more depth. But is anybody willing to tell me what category they're in as an organization in terms of asset size of your organization? And you may not know. I understand. Sometimes you're working in an agency and that information is not shared with staff. Now, sometimes that can be an issue. And that speaks to the culture of our organizations, because if we're all going to be effective in our organizations, and if our organizations have to raise funds, we can't always be the effective ambassadors or fundraisers for the organization unless we have the information. Typically, you can find it yourself. You can get a free account on Guidestar, open it up and discover for yourself if that information isn't shared. Some reasons to be concerned as you ask the basic questions of yourself to see if you're ready to apply for the grant. We talked about eligibility. Now, because this is a focused RFP for ending the HIV epidemic, more than likely, fit to mission is not going to be an issue for you in this case. The capacity includes infrastructure, includes not only your staff, but the building, the location, the access to your building, the type of staff that you have. If you're going to be asking for reimbursement for counseling, do you have licensed counselors who have the correct certification to get insurance reimbursement or TennCare reimbursement? What amount are you really going to ask for where you can be the most effective and most successful? And will you need to supplement the amount that you're asking for from other donors? And when will the funding arrive? That's so important, because if you don't know, if you're the grant writer, but you don't know from your other staff and leadership that they don't have 90 days of operating cash on hand, for example. That means the amount to run our operations and pay our staff, etc. If you're doing a new program that costs you money and you don't get reimbursed for 90 to 120 days, you might find yourself in a challenged position because you've already spent the money. Are you not going to pay your staff until the money comes back in to be reimbursed? So all of that's important. And I know that it can be very frustrating, one, if you don't have the information, but these are bits of information that I would encourage anybody asked to write a grant to ask for, so that you don't put yourself or the organization in a vulnerable position. Okay, other reasons. As much as nonprofits are usually teams of people who are passionate about the work and want to do good work, sometimes there's just dysfunction. And even though we don't like to admit it, we just have to look at ourselves and say, you know what? This is a time that we might need to pass. Are we really ready? Do we have a lot of passion? Do we have a lot of heart? But guess what? We don't have the infrastructure. We don't have that operating reserve. We're not ready. Can we even meet the basic requirements? Do we have the right staff to meet the requirements for that grant? Do we have the right facility to meet the requirements? How close is it to the deadline? Now, most of us who are working day to day, you know, and doing our work, we're knee deep in alligators, you know, so we're doing the work. And you think, oh, my mercy, goodness, I thought that was going to be 30 days from now. And you find out it's going to be 2 weeks. Do you really have the time to present the best case for support for yourself? And what's your competition? You probably know each other. If we have 40 providers who are serving individuals living with AIDS, it seems unconscionable that you would not be talking to each other or meeting or having some kind of cohort thing. I understand why that doesn't happen. But it's like, okay, you can get 40 people in a room. You can at least get 20 to 25 in a room, right? So we know that you probably do know each other, but maybe not in an in-depth way about what you really do. So that might be an opportunity to say, you know what? We just need to get to know each other better. Have a lunch every quarter. Take turns sponsoring the lunch and really begin to let somebody go ahead and present. I mean, when the world opens up again, we have a wonderful meeting space. I would invite you to get provider agencies together. And I tell you what, if you're willing to do it, we'll sponsor the first lunch. And Ernie will love that because she loves to feed people. Are you in the middle of a leadership change? If you're in the middle of a leadership change, you know, if somebody is really confident about, for example, I'm going to pick on Kim because he was brave enough to throw himself out there and participate. When Kim Moss left Friends for Life, people were devastated. It was like, what? What do you mean he's leaving town, going someplace else? What is the problem? There were a lot of donors and funders who had great confidence in Kim because he had developed those relationships. He had fulfilled his commitments with the grants that he had been provided. So it was very difficult for the person following Kim to, although there was some residual benefit because of the reputation of the organization, that was really hard for the new person in some ways, because there was this level of, can we trust this person to be as effective as Kim was? What do you think is going to happen now? Will the staff be happy? Will the staff stay? Will they change their direction? Even though we, as funders and people who review proposals and grants, are supposed to be completely objective based on the information provided, please make no mistake. We are all influenced by the normal human emotions. So just think about all these things, please, prior to responding. Now that we've done our homework and we're in the middle of writing the response, I know that you've read it because that was part of the homework. Read the fine print again. Follow the instructions and avoid jargon. And by jargon, I mean the terms that are so common to you, even PWLA. For the RFP, you're not going to have a problem using the acronyms of your discipline. But for a regular grant, there are still people in our community who don't know that PWLA stands for people living with AIDS, right? PLWA, sorry. See, I messed it up already, right? Some people don't know what a CD4 count is. Some people don't know what seroconversion is. Sometimes we just have to explain, and somebody was going to say something, and I apologize for cutting you off. Was somebody going to say something? Or was that just artifact from an open mic? Okay. So depending on our audience, if you're writing for a regular grant or not the RFP that's coming from the state, you might want to think about how we use the language if we choose not to explain it. And, we do need to check for typos and grammar errors. We do want to present as credible, right? And be concise and be complete. Sometimes we get so wrapped up in trying to evoke emotion or make an emotional appeal, and we use wonderful language and we tell a beautiful story, but we forget to completely get to the point. So many times, whether you're doing a grant application through an electronic portal or other means, we have space limitations, the size of the font, and all of that. So we have to make sure that what we're saying is complete and concise and communicates the most important message we want to communicate. So this is kind of like a cartoon. We don't want any of your proposals to be put in the trash file for doing something as simple as not following the format. I realize that's ridiculous. And you say, oh, why don't people care about quality? They do. It's just that when sometimes you throw 20 different proposals at somebody, for example, sometimes my board members have 20 to 40 proposals to go through in a quarter, and they don't get the full quarter to review them. They only get the time between the grant applicant interview and the committee meetings and the board meeting. So if it doesn't follow a format that they can easily follow, that they understand, that they're familiar with, guess what? It's going to frustrate them because they really want to get through all the material, and they can't if it's too far out of alignment. So I know that doesn't seem fair, but that's what happens. So now that we're writing the grant, the response to the proposal, we want to keep it simple. And we probably all learned way back when the who, what, when, where, why, and how. If you can do that, anybody can write a good grant. And remember, people only fund proposals they understand, unless you're lucky enough to be St. Jude scientist and you're presenting this very complicated research and people just nod and say, okay, you must be doing great work because here are the results. Most of us can't get away with that. So we have to put it in language everybody can understand. And remember, due dates are closer than they appear. Now, should you hire a grant writer? Basic things. The benefit of hiring a grant writer: expertise. They know how to dot all the I's, cross all the T's, make sure that you've got everything in perfect alignment. And they probably have the time because they're not doing the day-to-day work you're doing every day. But no matter how good that grant writer is, unless they're retired from your agency or something, they probably have incomplete knowledge of your organization. I mean, let's face it, we have grant writers who are paid staff in some organizations that have incomplete knowledge of their organization, right? And then there's a cost. Grant writers aren't supposed to ask you for a percentage of whatever grant you get. So you're going to have to pay them. And guess what? There's no guarantee that if you hire a grant writer, you're going to get the grant. So those are things that are pretty important to consider, right? Okay, the who, that's easy. It's the history of your organization, any background information, the reason you were created, and what your core business is. So very important to understand the core business. So many people get in trouble chasing a grant that doesn't support their core business, and pretty soon they're doing all these other things and they lose themselves. It's kind of like Confucius. He who whittles himself to please everyone else soon whittles himself away. So what partnerships might you need? Because, when we looked at the area and we looked at the number of cases and the finite amount of dollars available, I can't think of any organization that's all things to all people. So we probably need partnerships, right? And that can take many forms. Because of the size of our organization, we might get a fiscal agent, a fiscal sponsor. We might do a cooperative request. And before I go deeper into that, there's a difference between a fiscal agent and a fiscal sponsor. And I've sent a handout to explain it more completely, but it has tax implications And it also identifies how relationships can be established for the benefit of each organization in that relationship. The cooperative request may be that you say, you know what, we really want to go after this RFP, and I think we deserve $500,000 of it. But in order to do that, we really feel like we should take care of this part of the continuum of care. And so let's make an agreement that you do these pieces and we'll do these pieces and go for it. But, you know, whatever budget we create for each one, we'll just split it the way that it falls. Okay. So if you're going to do that, obviously the mission match is probably easier since this is a very specific RFP for people. And although Eddie did say that he was open to considering responses from organizations who are not currently in your list of providers, because he was open to looking at creative partnerships. And so because of that, we want to make sure that whatever, if it's a marketing firm, like yesterday we had a marketing firm. Well, will their messaging match the mission? Are they committed? Do they have a culture? Do they have a set of norms and beliefs that supports my culture? Right? You want someone who will be respectful of a person living with AIDS to do work with you. You don't want someone who only wants the money for the job. And what other partners might be out there that are seeking relationships with those same organizations? We need to know that. In order not to have bad feelings at the end of the process, we want to make sure our agreements are clear. So not only do you want to enter into the partnership agreement, it's almost like a prenup. You want an exit strategy if you have to have one, and you want to know how to divide up the responsibilities of the grant or the proposal dollars when you receive them. And we all want to be accountable for our piece of it. So what is it that we're supposed to do in order to make it work? Because at the end of the day, when we do evaluation that we're going to go into a little bit more deeply, we can't blame the other person and say, didn't work because they didn't do what they were supposed to do. No, we're all accountable for making it work. So what are we doing? Obviously, that's the purpose for which the funds are requested. Overarching goal to end the HIV epidemic, right? Simple as that. But obviously, it's like saying we're going to wipe out world hunger. Well, okay, how are we going to do that? So we're going to do that with a program or a project because we need a different building. It might be housing. Instead of buildings, it might be affordable housing. Do we need the technology? Do we need, and will this RFP allow us to build the capacity knowing that $2.5 million actually isn't enough? So will we be able to build our capacity so that we can get the, whatever the magic number is for the resources we deserve and need in order to serve those living with AIDS? So when, why, where? Okay, when's easy. That's the timeline. You know, you're doing day-to-day work now. You're already part of a solution that's being looked at, but it's not the solution. And we may have to have multiple solutions, right? But we start somewhere. Most proposals and grants have a finite timeline. You have a start date and an end date. So we have to be really clear about that and make sure that we have the capacity, the resources, and the funding flowing in at exactly the right stages of that timeline in order to make sure that we don't lose traction in any activity that we're doing. Where are we going to provide the services? Well, the planning document kind of outlines that pretty clearly in the planning area, the regions that we say that we're committed to serve. Now, the why is the most important thing because, as I said, linked to mission is not the thing. Well, the so what question. Okay, you're going to do HIV prevention training. Okay, so what? Well, we're going to have to figure out a way to answer that. And that's when we get to evaluation, right? What is the value that your organization is going to bring to this process? Is it because it's nice to do? We all love nice to do things. It makes us feel good when we can do nice to do things, but can we answer the so what, except that we made people feel good for today? Is it the right thing to do? You know, sometimes that's a harder sell because we can all be in disagreement sometimes about what the right thing to do might be. Is it a must do? I would say if it's an epidemic, by golly, it's a must do. It took a pandemic to get our attention right for a must do. Okay. And you know what the most compelling case would be? If ending the HIV epidemic would be impossible to do without you and your agency to do it. When you can figure that out, then there is no reason people should not provide the resources necessary for you to get that done. So let's look at the plan. One of the advantages is in having the delay to the RFP being published is that it should have given everybody ample opportunity to know and understand the plan and to reflect on how you and your agency add value to that plan. What is the essential role that you serve within that plan? All of us should have answers to these questions right now because we've had the time to do it if we've been part of the process. What are the key unmet needs? What opportunities have we missed and we know have to be out there? Have we really looked at the life cycle of a person living with AIDS? And by that, I mean from the beginning, prior to an infection, to what happens at the conclusion of our lives. Have we really looked at that? Where do we fit in serving the individuals we're privileged to serve who are living with AIDS? Where do we fit? And what's missing? Okay, so according to End HIV 901, the pillars are diagnosis, treatment, prevention, and response. In the HIV continuum of care, we have, okay, you're diagnosed, receipt of care, retained in care, viral suppression linked to care. Well, now, you know, these two can look very similar, right? But we know that that's just only part of the life cycle of a person living with AIDS. But even if you confined yourself to this part of the life cycle, what is it that you do that adds value or can add value to that process? In looking at healthcare, these are the factors that most researchers and economists will always go to. One, from the economic side, is the service, product, whatever, available? Okay, it's available. So early on, someone said housing. Okay, there's plenty of available housing in Memphis, but do we have access? Not. Is it affordable? So we have to look at cost. In many cases, not. Is it of quality? Not. There are places in Memphis that no human being should be allowed to live in that slumlords are collecting rent for. And do we have an efficacious process of getting people into homes? Do you know that we're part of the eviction capital of the world? There are some landlords in our community, I deeply regret to say, who are, if you look at Eviction Lab, Eviction, and if you have not read the book Evicted, please read that since we're on a housing kick today. Please read that. We had a young lady who was a graduate student, social work intern, working with us, and I had her do a project on evictions in Memphis. And she said, I did not realize that my landlord is one of the people who evicts people at the highest rate. And she said, thank goodness she and her husband always paid their rent on time, but it made her think differently about her relationship with her landlord. And rightfully so. I would be a little bit nervous about that. Other thing, and this we can apply the availability, access, cost, quality, and efficacy to almost any healthcare environment, right? Well, in all healthcare environments, truly. And then what behaviors do we look at? Individual behavior. Well, obviously you're addressing individual behavior in each one of your pillars, aren't you? Because it makes a difference because of the choices that are made by those individuals involved. Institutional practices. I can remember in the dark ages when I had my first patient with AIDS, what an unusual experience that was, not only in the way that we had to prepare ourselves entering the room, taking care of the individual and exiting the room, having to beg people to come in to clean the room. As a nurse, I ended up having to do it all because we had people afraid to deliver meals, everything. It was ridiculous. I understand the fear, but it was hurtful to see individuals treated differently. And I don't think it was a lack of compassion. I think it was fear, but still it was a painful experience. I had gone to another institution where I had a staff member tell me that they would refuse to do CPR on one of our patients who had a diagnosis of HIV. Obviously, as a manager of the unit, I had to take certain steps to address that. But, I am deeply grateful that we have come a very, very long way, but we have miles and miles to go. So even institutional practices, the community at large, which includes the religious community, and you would think that there are some faith-based organizations where people should be able to go to get comfort. We know in our community that is not always the case for people living with AIDS. We have to look at public policy. We have to look at if there are ways to make access and cost equitable for everybody within our community. So those are all things that we deserve to consider. And these are all issues that can be addressed in your response to an RFP of how you and your organization can make things better. So in light of that, we talk about the determinants, and housing was mentioned previously, but obviously food insecurity. Anytime we have an immune compromised individual, we know that they need good food and access to healthy food and quality food. We know that it's difficult to get to treatment if there's a lack of transportation. Some individuals living with AIDS experience various degrees of violence, whether it's verbal abuse or physical abuse. The geographic and racial context, I remember an individual I know who said, honey, if you think that's bad, because I was moaning and groaning about something, and he said, honey, if you think that's bad, try being Black, gay, and disabled in Memphis, Tennessee. And the way that he said it, I laughed out loud. It certainly made me quit complaining about what I was complaining about. And it wasn't funny, but the way that he said it was funny to me, and because he was a friend. But, it was a very sad truth in the things that he had to experience. Lack of health insurance, education status, and these come from the End HIV 901. So we have levels of literacy. I think it's worded illiteracy, but the reason that I changed it to levels of literacy is you can have a PhD and still be functionally illiterate in certain domains. A friend of mine, a researcher who used to live in Memphis, said that her husband was running around and showed her some cookies. Now he had a master's, and he said, hey, look, cholesterol free. And she just rolled her eyes and looked at him. He was an engineer, but, she had to re-educate him on healthy choices. But, we have all of these, the trauma, the mental health, substance abuse, and the social injustice and disparities within systems in our community. Some things that exist that we're not even aware of at some points because we don't know the structural or historical basis for why that system exists. So all of those are important, and all of those deserve to be considered under that HIV miscellaneous category. And these are all areas that I trust that you've had a chance to reflect on as you think about how you might respond to an RFP. For social determinants for data, if you feel like you need data, I'm not going to go over this, but this is part of the slide so that it's part of your handout because you'll be getting a copy of this. Here's a resource for you to pull some demographic data, very much like a GIS mapping, and providing some information that might be helpful in making your case. So let's get to the how. Relationships with other organizations, your implementation strategies, the accountability and assigning the roles. I know we've talked about all this before because we were supposed to think about these in our homework, right? But this is now getting to the nitty gritty where you really define what your actual costs are going to be, how you're going to do your evaluation, whether you have the capacity, and how you're going to ensure that you have the capacity and resources to do the work, and the contingencies. What is your contingency plan? And I'm not asking you to plan for the pandemic. I mean, I don't think there was anybody who planned for the pandemic. We had people who had emergency preparedness plans and disaster plans, but they did not have a pandemic plan. Although I must say, for people who participated in Ready Shelby, we did have a section on pandemics. But that was a big thing, big contingency, right? Well, we have everyday contingencies that you're familiar with because you've for those of you who have been in the work, you've experienced things that have happened. So you kind of know that you might want to plan for certain things. Somebody drops out, promises you funding for 3 years and drops out after year 3 or something like that. And you want to know about sustainability. I mean, why? Everybody hates that question, but look, $2.5 million, please. We cannot end HIV with $2.5 million. I wish we could, but the reality is we cannot. And so we have to have a sustainability plan. One of the ways that we look at resources, and a tool that I like from my total quality management, continuous quality improvement days is the Ishikawa diagram, because it forces me to think about everything that's involved in getting to the problem. It helps me to think through the life cycle. It helps me to think through what ifs. Now, this is a tool that happens to work for me because, I learned on it and I kind of liked it, and it makes it simple and it makes me think in a certain way. This may not work for you. So find a tool. It may be journaling. It may be using something else. It may be a pros and cons list. I don't know. It may be some other type of algorithm where you do a flow chart on the life of a person living with AIDS. I don't know. Whatever works for you, use it. This is just one tool, but it will help us to think through all the things that we need to make something work. Now, obviously, writing goals and objectives, that's very important. You'll be having an entire session on that, so I'm just putting it out there. You'll find specific, measurable, attainable, relevant, and time-bound, which are called SMART goals, but you'll have a whole section on that. Budget. You'll also have a whole section on budget. Even if you don't know how to do a budget, just simply as sources and uses of funds. If the RFP requests a specific format, please, 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 please use that format. The important thing is whatever you put in that format deserves to be accurate, aligned with your project. So, if you're not asking for operating support, be accurate about where the money is actually going to go. Is it a sufficient amount to accomplish what you say you're going to accomplish with this phase of ending the HIV epidemic? Is it realistic? Now, if you're single-handedly going to wipe out the HIV epidemic, you need all the $2.5 million plus. So it has to be realistic. Can you justify the things that you're asking for? If you're going to hire a consultant, is it at market rate? Do you have bids if you're working in a certain type of agency that requires you to have bids? How do you know, et cetera? What other donors can you line up for the project? Because not enough money. And of course, the issue of sustainability has to be addressed, because if you've done a strategic business plan, you know that. And by the way, you're going to have a session on that too. So all of those things are important. This is the highlight overview. Okay, so if you want some ideas on what goes into sources of funds, these are things that go into sources of funds. Typically as a nonprofit, we have to depend on contributions, foundation grants, government grants, investment income if you're lucky enough to have an endowment. Contracted services might bring you revenue if you're doing services for somebody, events, program fees. I'm sure that you can triple this list, but this is just a way to get you started to think about all the things that might be included that you want to make sure that you've got covered either by the grant or from some other source. And then uses of funds. Here's a lot. And I have fundraising down here because a lot of people fail to include fundraising as an expense. So there are some who would argue that the time you're spending with me today is a fundraising expense because you're learning how to raise funds through grants. So, how you quantify that, how you record that, you would be surprised the number of 990s that we look at, the financial statements of nonprofits, where there are no fundraising expenses. And we know that's not true. You deserve to put that in there, and I'll explain a little bit more about that later. And here's where we explain it. Know how to read your 990. So you say, well, I'm just a staff person. I'm just a researcher. I'm just a whatever. One, you're not just you are an important part of the team. You deserve to understand. As a nonprofit, we have a higher level of accountability than some people who are privileged to work in other locations that don't have accountability for knowing. So learn how to read the 990N, the 990EZ, or the regular 990, whatever your organization files. Open up that free account on Guidestar, look up the organization, and the 990 will pop out. You'll see a bunch of numbers. Some of you will know immediately what they mean. Others of you will say, what is this? And that's okay, because that gives you a reason to go ask somebody who can help you and explain it. There are key performance ratios that organizations look at. There are financial performance metrics that organizations look at. So if any of you are going after a national funder, they are going to be looking at these key metrics. We have a homegrown tool that we share in our program Before You Ask that will help you understand a 990, and we provide the formulas that will help. If you want to see what not-for-profit expense ratios are looked at, there's a CPA Journal article from 2019, and there's a link to it on this slide that you can look at. Charity Navigator is an organization, and those national foundations who use Charity Navigator obviously look at larger nonprofits. But if you look at Charity Navigator's link on this slide and follow it, you will see the performance metrics. If you get frustrated because you do not get a response from a national funder, it may be because your organization did not fall within the correct parameters for those performance metrics. So the charity watchdogs, just so that you know, are Charity Navigator, the Better Business Bureau, Wise Giving Alliance, and Guidestar. And if you want to immediately get into Guidestar with a decent rating, complete your profile on Where We Live, Where to Give Mid-South. That is something that the local funders have supported at the Community Foundation. And if you will complete that profile, it will at least help you to understand where some challenges might be for your organization in getting funding from major grants. Okay, now evaluation. You wanted to talk about a little bit more about evaluation. It doesn't have to be expensive, complicated, or time consuming, but we got to follow the criteria for whatever type of evaluation you select, and the methods, the types of data analysis and reporting. And I was asked to share with you what funders look for. I will tell you this: funders are horrible about evaluations, and that's the God's honest truth. The majority of funders will not fund the rigorous type of evaluation that, in truth, we all want, because sometimes it costs more to fund the evaluation than it does to fund the program itself. So what most funders do, and we are guilty as the Assisi Foundation, is we just say, okay, how are you going to tell us how you did, what you say you're going to do, and how well you did it? And we're going to look to see how you set it up. And we're going to hold you accountable to how you set it up. So there are funders who are more specific about their evaluation criteria. If you come across grant application guidelines or an RFP that has specific guidelines about evaluation criteria, make them pay for it if it's not in your budget. There is a cost to doing evaluations that way. So we're going to talk about some of those. All right, there are levels of program evaluation. So it can be reactions and feelings. That can be both quantitative and qualitative. Whether someone learned, whether there's changes in skills, that requires an observation component, and whether it was effective or not, however it is that you choose to measure effectiveness. So those are the basic levels. And of course, at each level, it's going to cost more money to figure out whether we accomplished what we said we wanted to accomplish in those. So the next 3 slides are going to be sample evaluation tools. You're going to get a whole in-depth presentation on evaluation by others later in your technical assistance series. But logic models I like. Kellogg has a fabulous book. The Kellogg Foundation has a fabulous book on evaluations, and I'll try to, they've quit publishing that, but I do think they have a link to an online version still, maybe. I'll try to find that for you. But this is another tool that you can use to trigger your thinking about, okay, have I really included everything in here that I might need to include in terms of my process and my program and my plan? So you have inputs, outputs, and outcomes. We're going to talk a little bit more about that. But you see the situation, the needs assessment, and obviously you've done a needs assessment in your plan. So it's not like you have to plow that earth all over again. And then your priorities based on your organization, and you've got all this other information there. Now, here's another from the Dreams group, and this is specific for HIV, so that's why I put it up there. So you can see that it says reduce new HIV infections, right? But look at all the various, not only have they put everything in context, they've selected specific interventions that they say they're going to be committed to, what outputs they expect, and what the eventual program outcomes will be. Now, in order to prove that we have improved family interactions by increasing and receiving parenting information and having parent caregiver programs, that's going to take a lot of follow-up and specific intention in order to measure. We don't have that. But because you have this link and you have this data, you can actually call people and say, hey, how did you do that? If you think it's worthy, you can ask to have an opportunity to replicate their tool. No harm done. As a matter of fact, it's helpful because then you'll have a comparison group with what they did in their location. Here's one that's I said 3 slides, it's 4 slides actually. This one is for health promotion, prevention and management, because I know some of you do that. So here is how they laid it out. They don't have the very specific strategies underneath, but you can do that. You know what's relevant for you, but this is a tool to help maybe you to think in a way to present it in the most effective way for you. Okay, and then we have this that's very colorful, and I like it. It's for girls and young women at risk. But and this is a global one, but you can see all these different elements that we're going to include in order to empower girls and young women and reduce risk for HIV. And remember, we talked about individual institutions, communities, and policy. If you look through all of these, you'll see elements of that in these different intervention areas. Okay, and so evaluation methods can be questionnaires, surveys, and checklists. You can see how you might apply that to some of the things that we saw in the previous slide. Obviously, if we're working with families, groups, parents, young people, it might require interviews. It might require a review of documentation, observation, focus groups, case studies. All of those are different ways that you can use to collect the information that's required. Now, measurements are going to be important. Some people will say, look, I'm doing cost benefit program to expense ratio. By the way, that's a key performance metric. And in addition to that, you know, the key performance metric will look at operating reserves, but we won't do that in the evaluation measurements unless you're actually doing a capacity building grant. Okay, you want to know, your funder will want to know how you're going to measure the results. This is like, how do you know that you did what you said you were going to do and how well you did it? Will it be a short-term thing or a long-term thing? Because in the year that you provided the program, you may only be able to do a short-term result report. The long-term measure is going to be 3 to 5 years down the road or longer. Might be a whole generation. We want to select the right tool. If it's a short-term measurement, we need to do something like, if we're going to say a focus group, okay, we can probably do that in the short term, right? But we're not going to be able to do longitudinal studies in the short term. So we're going to have to select the right tool for whatever evaluation we're going to do. Okay, outputs are the easiest things for us to measure. So if we look at the logic model, outputs is another word for results. But if you count something and it doesn't lead to anything meaningful, the results are meaningless. So it's just like when the Meals on Wheels program was established in this country, technically the Older Americans Act was supposed to address the nutritional status of frail, elderly, homebound adults. Well, you know, the Older Americans Act in its wisdom said, go tell people in communities to count the number of meals they delivered. So even I, as a lowly nursing student, understood that that didn't get it. If I'm trying to improve the nutritional status of homebound elderly residents, how is counting the number of meals delivered going to give me that information? It's not. I don't know who ate the meal. I don't know if nephew ate the meal. I don't know if the meal got thrown in the trash can and only the applesauce got eaten because they didn't like everything else on the tray. I don't know any of that, right? So the thing is, when we decide to put a measure in, and so a funder's going to look at that. If you say, I'm going to I'm going to end HIV. Well, okay. Show me what you're going to measure to prove that you did it. And show me how you did that thing that resulted in that result, right? That sounds kind of funny, resulted in that result, but achieve that result. Okay, so outcomes. Outcomes are more difficult to measure because we want to know that what happened is directly a result of what you did. And we've already listed we had 2 slides with a whole long list of social determinants on those slides, right? So if we don't address all those determinants, unless we have the capacity to do that, we may not be the ones that were responsible for getting that positive result. So you may have done everything right as a healthcare provider, but because of poor housing or no transportation or no ability to get the right meds, you may have made the correct diagnosis. You may have prescribed the right treatment. You might have been the nicest person that person has encountered since his or her diagnosis. But the outcome is going to be horrible, isn't it? If we haven't addressed all those other things. Okay, we have to prove in an outcome statement that the change happened because we did it, because we did those activities that led to that result. So we have to say this is the degree to which new HIV infection rates decreased because of the specific activities provided by your agency. For impact, that's tough, because we have to say we're directly responsible for what happened. Us. If we weren't in the equation, it wouldn't have happened. And that may be true. We just have to be able to prove it. It's very difficult to measure. It may or may not happen because of all that other stuff. It does require some form of analysis, preferably established on the front end. And we have to hold static the effects of other influences. So all those social determinants notwithstanding, whatever's going on with all that, whatever we're doing is going to push us to getting the result that we want. So that we can say, the changes are directly linked to the efforts of our organization. And that's just the way that it is. This is what I'm saying is the gold standard, and when it's just impossible to accomplish without you. Okay, it is the gold standard. All right, so let's play a little bit. If we want to decrease the incidence of new HIV infected young adults at XYZ school in South Memphis, okay, we're going to say that this is what we're going to accomplish. We say that by the end of year 1, we're going to provide the young adults in South Memphis at XYZ school with a 2-hour training program that will provide information about HIV and STD transmission. Okay? And the instructors will track the number of young adults who received the training, when they received it, and where. So what's missing? Anybody? And I don't care if you were here yesterday. We can talk. Don't be shy.
Well, there should be some way of measuring their change in education, a pre and post test, perhaps.
Yes, thank you, Kim. And look, there are a lot of people who will read this without all this superfluous information and say, well, that's not a bad expression of a goal. We want to decrease the incidence of new HIV infected young people. We're going to, in year 1, provide 2-hour trainings to these young people. And we're going to track the number of young adults who receive the training. But here's where it is. If we just want a result, and we're not, a lot of funders will not punish you for this, because if this is what you say you're going to do, they'll say yes, but it'll be funding knowing that it doesn't answer the question of the primary objective, right? So funders are complicit in not always forcing the evaluation to produce the result we want to achieve or the overarching goal. So it is not just the fault of the nonprofit. It's because the funders sitting back and saying, we may not have the resources, or we may not want to fund what it's really going to cost to get to the other answer. So a result would be, okay, 100 young adults got a 2-hour training on HIV and STD transmission in calendar year 2021. That's legit, okay? If somebody funds you for that, that's great, because that's all you have to report, that you, by golly, provided that 2-hour training program. in calendar year 2021. Now, for a higher order of things, we're going to go to outcome. So if you have built in a measurement tool, you can say, you know what, 80% of the 100 sexually active young adults ages 14 to 19 from South Memphis at XYZ school who were provided a 2-hour training program on HIV and STD transmission and participated in quarterly follow-up visits in calendar year 2021, reported using methods explained in training, and tested negative for HIV and STD during the 18-month follow-up period. So obviously we have a baseline of those students. We know that they did not have HIV before the beginning of the experience, and they continued to test negative with the 18-month follow-up. So this is an example of how an outcome might be written. Okay, now, so let's go for impact. Now we're getting a little bit more specific and getting to some things that Tim mentioned. 70% of the 100 sexually active young adults ages 14 to 19 from South Memphis at XYZ school who were provided a 2-hour training program on HIV and STD transmission in calendar year 2021 scored 90% or greater on a test for awareness of HIV risk behaviors, reported using methods explained in training, completed each quarterly follow-up visit, and tested negative for HIV and STD compared to 100 sexually active peers ages 14 to 19 from the same school who did not participate in the training and follow-up visits for the 18-month calendar time period. Phew! Okay, so now you can see the difference in the type of information that you decide you want to provide. You can also see, just by reading this, what's going to be required of you and your staff in order to properly document and report that, right? So now you can see why it costs more money. All right, now you've completed the proposal. You've done that evaluation component. You've basically taken the why, who, what, when, where, how. Don't blow it now, because we want you to be successful. Follow the submission requirements. So if they say put it in a green envelope, find a green envelope. Most people aren't that ridiculous, but you know, if they say hit the send button before 12 midnight Eastern time, make sure that you understand what time zone you're in so that we don't submit it late. I can tell you that we helped an organization submit an application for the MacArthur Foundation 100 and change grant, the $100 million grant. They ended up being a finalist. They didn't win, but in any case, I said, okay, if we're going to help you, we're not going to be the ones that did not submit on time. So get everything in here because we're going to send it 2 days before the deadline. By golly, we did. And guess what? The day of the deadline, the site crashed for about 3 hours. Don't you know we were relieved? Follow the submission requirements. So in your final review, go back. I know that I told you to do this before doing your response, but review the basic guidance again. Have someone else review it, preferably somebody that doesn't love you and doesn't know your business, your agency business, so that they can really look at it with fresh eyes. You know, did you tell the truth or did you fudge a little bit? Because if you fudge a little bit, it's going to come back to bite you. And then here's Grammarly and Hemingway are 2 apps that you can download just to make sure that you don't sound like a dork to the reviewer. And let me explain. You know, we are all guilty of this. We know what we want to say. So when we read it, we think we said what we wanted to say, when sometimes, you know, you look at something you wrote 3 days ago and you thought, what is wrong with me? Because you just didn't see it. So that's a good way to look at it. Check for typos, of course. Change the size of the font. If they tell you they want it in 12-point font, of course, you're going to make sure you change it back. But do it in 14, 16, or 8, just so that your mind has to absorb it as new information and begin to assess it as new information. Sometimes it helps to sleep on it. Always helps me to sleep on it. I don't always get to sleep on it, but it does help me personally. Reading it out loud helps. I know that John is masterful in our office about editing things for us. And a lot of times, if he is not familiar with, the technical language, and he's pretty brilliant, he'll read it out loud to see how it sounds to his ear. And then obviously ask someone else to read it, preferably maybe somebody 14. They're not afraid to tell you that they think it sounds stupid. And they're usually pretty bright and reasonable about their criticisms when you ask for their advice. Not always, but try it. So now what happens after the grant? Because there's always after you get it. Hopefully you'll be funded in full. You might be funded in part. I doubt if in a response for proposals you'll have a challenge, you may not be funded. So let's think about this. So once you have the decision, obviously it's okay to request feedback. Hopefully there'll be a response. Ask others again to review it to make sure that maybe they see something that we can't see. And obviously from the very beginning, hopefully you have already started exploring other funding options as you were writing the response to this proposal. And remember to use basic manners, because tomorrow's another day. This is not the time to tell Eddie Wiley he's an idiot because he and his team didn't fund you, because, they might have another wave of funding coming and he's going to remember that you called him an idiot last time. You don't want to do that. If it's a challenge, if you're applying for a grant from a regular foundation or something, obviously read the small print and check the time for the requirements, because sometimes it's not reasonable from your perspective. It may be reasonable for the funder's perspective, but you may know your donors enough that you know that you need more time because of the cycle in which opportunities are presented. Obviously, check the match requirements, 2 for 1, 1 for 2, whatever it is. And it's okay to walk away from a grant. So if you don't feel like you can meet the requirements or that they're not open to exploring another option, walk away. And then if you do accept, please fulfill all the requirements, turn the reports on time, and maintain communication. If for some reason you can't turn in a report on time, maintain the communication so they understand that you're not blowing it off, that you really, whatever happened, right? Even if you're funded in part, obviously you're going to explore other funding options. If for some reason you're not able to get the balance of funds, or you can't redirect funds from another program that you have or another out of your operating reserve, request a change in the scope. If you said you're going to serve 100 people, you might be able to do it for 50 because of the amount you got funded. Sometimes economy of scale doesn't work. And whatever the decision is, obviously graciously accept it. If you're funded in full, still read the fine print and check the requirements, negotiate any changes if necessary. I would find it difficult to walk away from a funded in full grant, but that might be necessary if the prescribed conditions of the grant set you up for failure. That will not happen in the RFP. I can't imagine it happening anyway in the RFP process, but sometimes it does happen with a private foundation or other foundations. Accept it, fulfill the requirements, turn in the reports on time, and maintain that communication. Remember, no job is finished until the paperwork's done. All of us have heard that at some point in our lives. In your reports, review the process for reimbursement. Make sure that they're honoring. You hold your funder accountable too. It's not just you holding yourself accountable. Mark the due dates on the calendar so you don't miss it, and follow the requirements. Other options that I was asked to about, some I offered before. Some of you have heard about Willie Sutton. Willie Sutton was born in 1901. and he died at the ripe old age of 79, but he was in jail. He got arrested like 11 times. He'd escape, and he was quite a character, apparently. And he was a bank robber. He started at a very young age. And so when somebody asked him why he robbed banks, he said, because that's where the money is. So let me show you where the money is in nonprofit work and charities. This is from the 2020 Giving USA report for data from 2019. So in 2019, Americans gave $449.64 billion to charity. $1 billion. 69% of that money came from individuals. So you'll get a chance to look at this slide a little bit more specifically, but here's the breakdown. Look at this, 69% from individuals. Now, as you know, ALSAC, St. Jude, they are the master at getting individual donations. When Danny Thomas was alive, he probably got all the little old ladies to write $5 a month checks. Now I think the average donation is $20 or $25 a month from him. Thousands, hundreds and thousands of individuals. You too can develop those relationships. 69%. That's where the money is. We're spending all this time talking about grant writing. Maybe we should be spending a lot of time about making our case for support to individuals, because 69% of the money is coming from individuals. That's a compelling figure. Here's something about role of boards that I was asked about yesterday. Boards have governance accountability. If you have a new board member, hand them a copy of the Tennessee Attorney General's Guide to Nonprofit Boards. It's available on the website. Boards have a fiduciary responsibility for the organization. They should each be expected to make a financial contribution. I realize some of you have consumers on your clients on your board. That's okay. They can give or get. They know people. Each board member is supposed to be an ambassador or champion of your organization. They can't do that if they don't understand your organization. So it's really critically important for you as the executive director, if you're the executive director and staff, to educate the board. Typically, that's a responsibility that falls upon the executive director. And each one of those board members has accountability to mission. And by that, I mean the mission of your organization. It's not to make their resume look good. It's not so they can have a social connection that they want to, or get to go to a nice gala or a party. It's accountability to your mission. The other thing I was asked to mention something about was fundraising. In order to be an effective fundraiser, we have to understand the mission, right? And that's whether we're a board member or a staff member. And sometimes fundraising just starts first out with fundraising. There's another program called Network for Good with a Jumpstart program for smaller organizations. Please look at Momentum Nonprofit Partners. Assisi underwrites that program. We've been fortunate that based on the success or the positive feedback we've received from groups, that other local funders have now participated in funding organizations for the Jumpstart program. And the arts groups, there's a select group of arts groups that are participating in the Jumpstart program. So be looking for that. And if you think you might have an interest, certainly go ahead and apply. And hopefully you'll get into the next cohort. If you decide to hire a consultant, be very careful, look for references, make sure that you check costs. It's really important. And they too will have to truly understand your mission. And there's social entrepreneurship. We gave the example yesterday of one of the earliest ones is in Minnesota. It's an American Red Cross chapter, and they have a durable medical equipment store, and it's a for-profit business, and that is legal. A nonprofit accountant will explain that. And so instead of all the proceeds and the profits from the for-profit going into the pockets of shareholders, the shareholder for the for-profit assets are actually the nonprofit chapter. So this helps to supplement, other grants and contributions received by the Red Cross chapter. So, one of the things that we can be thinking about is there something within the life cycle of a person living with AIDS that everybody needs? I don't know if there is or not, but maybe we need to have a store that provides that. As you know, Salvation Army has a thrift store, Goodwill has a thrift store. Those thrift stores are to help their mission. I was sharing with a group yesterday that, they have this thing now where if you buy something that's $14, your bill comes out to $14.96. They'll ask you to round up. If it, comes out to be $14.46, they ask you to round up. So you may think that 54 cents or 4 cents isn't much money, but if you've got 1,000 people coming in, rounding up anywhere from 2 cents to 98 cents every day, guess what? That's going to add up to a lot of money at the end of the year. So I know that was a lot, short period of time. I invite your questions. Okay, silence. I put you to sleep. Hello? Are we there?
I don't really have any questions, but I really did value what you said about, well, there was two things that really just stood out at me because these are things I'm currently struggling with in my academic as well as professional things. But you were talking about, making sure that you're not really, I guess, overcommitting. Just because you can doesn't mean you always should. And so
Exactly.
just knowing your limitations. You use the example of Aisha being kind of doing multiple roles, and that's difficult to do, to be 100% for all of the things on your plate, so eventually you start, really running yourself too thin, and then things are suffering, and it's just an uncomfortable position, and we don't want to, leave anyone lacking because of, us just overcommitting. So I really appreciated that piece. And then the last part where you were talking about, okay, we're discussing writing grants, but maybe we should also really discuss on our, not our arguments, but our presentation and how we approach our donors and things like that, and just really creating that sort of approachable dialogue where we are engaging with the audience that we're really trying to, get their attention and things like that. So those were just two things that I really appreciated. So thank you for touching on those things. And I was thinking about them in the back of my head. And then when you actually talked about it, I felt immense validation. I was like, oh, maybe I'm not so far off in left field and not understanding this. So those were great points. So thank you.
Well, thank you, Amber. So, Latrina, welcome. Did you have any questions that you wanted to ask, or any comments about what I should cover?
No, I didn't have any questions at all at the moment.
Okay, if something comes up, I'm here. And
Okay, thank
Aisha
you.
and Sherry knows how to get in touch with me. Ann Brown, did you have anything that you wanted to ask? Maybe? Yeah, I see you. Ann, I thought I saw you take yourself off mute. Maybe not. Okay. Ashley, welcome back.
Thank you. I don't know how I was knocked off, but I did have a couple questions.
Okay.
I wanted to know if you could speak more about operating support.
Yes.
And I also wanted to know about the letter support and the memorandum of understanding, and how would that be useful in this process?
Okay. So Operating support. For a while, that was not popular with funders because some funders acted badly and they got their hands slapped. And the way that they acted badly was some foundations, a few of them, were telling their grantees that they could have this nice size grant, but they had to hire a relative of one of the foundation people to be on the staff and things like that. Or they were saying that you can have the money, but you have to use it in this way specifically, that had to do with what we would call a conflict of interest opportunity, like using their firm to renovate your building or something like that. So the IRS came down really hard on foundations after a whistleblower did this with several foundations. And so a lot of people went away totally. You know how some people have a knee-jerk reaction and just go to the extreme opposite behavior? Well, they quit funding operating grants, period, because they weren't going to, they were lived in a small community and they weren't going to be accused of anything like that. Well, the pendulum has swung, but for operating support, we want to make sure that we have a viable organization, that our 990s look good, and we want people to understand and believe that we have an effectively, efficiently run organization. So the way that you frame your request is to provide examples of your effectiveness and your deliberate thoughtfulness of how you've structured your organization to do the work. And as far as letters of support, be very careful in letters of support. We have had letters of support from organizations, and because we do read everything, people think we don't, but we do. I have called people who have written letters of support who don't have a clue about what they wrote that letter of support for. They're just saying, oh, we want Assisi Foundation to fund this organization because they're friends. But they had no idea what project or program that they applied for or what their role would be in it. So if you're getting a letter of support, make sure that the person writing the letter of support clearly understands why you're asking for that letter of support, why it's important for them to provide the endorsement, and that they really understand what you're applying for when they write that letter. The thing that you asked about memorandum of understanding, that's just a very clear-cut agreement about what each party or number of parties will be doing as far as the project is concerned. And so it can be a very simple one, or it can go into great detail. The one that you want, the cover letter or the basic memoranda might say these three organizations, I'm just making that up, have agreed to work together. The actual more legal document, if you will spell out the accountability of each partner. And it'll be signed and dated by all parties. That's come in quite handy in some of the grant relationships we've had. Does that answer your question?
Absolutely, it does. But it also, I have another question, if that's okay.
No problem.
When you speak of grant relationships, in a forum like this, what is the best way to join forces with other programs? Yesterday, you spoke a lot about the bigger impact that it would have for organizations and what it would look like to get a piece of the pie by joining. Could you speak a little bit more about forming relationships in the grant process?
Sure. We have found that in this community, people will gather around food. So we offer to host a lunch or a breakfast, and we get people together and just introductions. And then you'd be surprised getting people in a room and saying, is there a way we can work together? Just something as simple as that. People can come up with the wildest ideas. One of the really interesting relationships that happened in a Before You Ask class, because we ask people to talk to people that they normally probably don't think they have anything in common with. and see if there's something they can work on together. Well, Reginald Milton was working on the South Memphis Alliance SUDS, the laundromat in South Memphis. And Southern College of Optometry happened to be in that class. Well, Southern College of Optometry ended up putting a vision screening machine in there, and I think it stayed there for 3 years, where people could actually test their vision while their laundry was being done, and they get a little printout that they could take to their provider. It was a basic vision screening. Another situation is that Mid-South Spay and Neuter needed dog houses for the animals that were getting adopted. And so Boy Scouts happened to be in that particular session, and the Boy Scouts ended up building dog houses as part of an Eagle Scout project. And so at no cost to Mid-South Spay and Neuter, they got a bunch of dog houses. So we have no clue what might happen when people get creative and think about it. But first, we have to have the introduction to convene. And as I said, when things open up, if a group of you want to meet at the foundation, we'll be happy to host. Does that help?
Yes, thank you so much.
Oh, absolutely. Sharice, may I answer something for you? Are you there, Sharice? Okay, she might have
Yes,
had
I
this.
was
Okay.
actually just talking to Aisha about how it struck me one of the things you said about very early on about just following the instructions and going back and checking for those smaller things at the end once you've done the big job of putting together the whole proposal. Don't let it fall apart at the end, and check, that you got the typos out and the grammar errors, and that we have a service for that here at St. Jude for those based at St. Jude, or partnered with St. Jude in cooperation for writing the grant. So we don't write the grant. We can't check your budget, but we can help in that area.
Well, that's great to know. And you want it before the last minute, don't you, Sharice?
Yes, please, because it has to be turned into another office, and so you want to get that turned in on time everywhere that it needs to go. So we need, a bit of lead time. So give us a few days at least to be able to quickly go through things and give you some feedback.
Okay, Sharice. So if something's due on Friday, the 15th, let's just make up a month where Friday falls on the 15th of the month. When should we get that information to you in order for you to be able to give it back to us in time to correct our mistake?
Well, by due, so you'll need to turn it into the budget to the office here before the 15th. It's not
Right.
being sent out directly by the researchers themselves. So we will need it from you, let's say 2 weeks in advance.
Okay, so that's
So that
good.
we can get it back to you. Maybe there's a couple of rounds of review. If we suggest a change and you don't understand and you want to ask us why we suggested that, or send your revised version back, which is not required, but if you want to do that and have us look at it again, you have time to get that done before you have to submit it to the internal office before it can go out.
That's great. So everybody on the call, you know that if you need it by the 15th, you got to get it to Sharice by the 1st at the latest. See what I mean by
It would be much
deadlines are so much.
appreciated. So, we try to work with whatever time you give us.
Oh, don't give them too much wiggle room now, Sharice. Trying to help everybody stay on
For
target.
money, we try to work with whatever time you give us, and we'll let you know if that's just not possible. We will let you know quickly that we won't be able to review it, but we'll review whatever we can in whatever time.
Well, we thank you for that offer. Latrina, is there a question I can answer for you?
Ma'am.
Okay, well, thank you for joining us. And L.E. Gregory, is there a question I can answer for you?
Hi, I didn't know I showed up as L.E. Gregory, but my name is Leela.
Hi,
Um,
Laura.
Hi, I really didn't have a question. I actually came in a little bit late, but I was able to gather a wealth of information, and I appreciate that. One concern I have would be centered around the population that we serve, because
Yes.
many times we encourage our consumers to be their own advocates and to kind of create their own opportunities, because, who knows better what is needed than a person experiencing it. So, with that being said, would it be safe to say that beyond the proper terminology and strictly following the request of the grantor, is it not as intimidating as it may seem to a person who's never stepped into this environment before, writing for a grant?
It can be very intimidating, even to
Mm-hmm.
people who are experienced
Mm-hmm.
because of the process. But if you're asking your beneficiaries to advocate for themselves, one of the things that we can do is we can help be the translator, right?
Okay.
So because not everybody is experienced with the language of grant writing or with, you can honestly represent and be an advocate in their voice, but framing it in language that the requirements say that you must submit it in.
Mm-hmm.
And so that you can basically, it's like being bilingual. You have to translate the desires of the individual and honor the integrity of their desire in presenting the case for support.
Okay.
That's our role as their advocates if they don't have the language to be successful. That's part of the currency, if you will, of being able to navigate in this situation. We're talking to, like in a foundation world, we're talking to teachers, physicians, clinicians, educators, bankers, professional business people. We're talking to people from all walks of life, and we have to figure out a way to translate all these complex things we're doing in language they can hear. That's why many times when you're talking to foundations, you'll hear about return on investment. You'll hear the language of business. So to the extent to which we can translate what we know that the people we're privileged to serve deserve and want, then we are serving as advocates on their behalf. Does that help?
Absolutely. Thank you.
Okay, thank you, Leela.
Mhm.
Maria, Anaya, may I answer a question for you? You may not be on, you may not have a microphone on. What I see, you do. Maria, can you hear me? I can't hear you.
Can you hear me now?
I can.
Okay, I'm so sorry.
That's
I'm
all.
having issues with my system here.
We understand.
Yes, ma'am. What is the question?
What did you have a question I can answer for you?
Oh no, I'm sorry. My system. I'm being it.
Okay,
I'm sorry.
that's all right. Appreciate you being on the call. Maria Randall, may I answer anything for you this morning?
Yes, it takes a few minutes to get to the unmute.
I know.
So, thank you for your patience. I don't have a question, but I just wanted to make some comments. I'm just reminded as you presented this morning how important these key pieces are and how, like the deadline, you said it's going to be sooner than later that pops up. And it does. Time flies. And so we think that, oh, we've got all this time in the world. And then all of a sudden it's due. And we've got to meet those deadlines. And the other thing was how when you talked about the way you need to specifically write the grant and make sure you read the fine print. That is so critical. So I was just reminded of all that. And then the other couple of things was Amber brought this up about how we overcommit ourselves, and it's okay to say no because we can't do it all, and we can't. I hope men don't take offense to this, but as women, we have a problem with that, and
I'm gonna take up for you.
yeah, and so we always say yes to everything, and then if we don't take care of ourselves, we can't take care of anybody else. And so we really need to have that balance. And then I really appreciate the resources that you provided, because there were several resources and links that I don't know if others weren't familiar with, but I certainly wasn't familiar with. So I really appreciate that.
I'm glad that you'll be able to use them, Maria.
Thank you.
Stacy, how about you this morning?
Good morning. How are you today?
Great.
Good. Yeah, I did have a question. So when nonprofits come together, especially like in this HIV crisis that we're having here in our community, if they come together and they form a coalition or an alliance, a few of them, are they eligible to apply for a grant as a coalition or an alliance? And if so, what is that process?
Unless they're formally structured through the IRS as a 501c3, that alliance cannot be the grant recipient, but a member of the alliance can be the grant recipient on behalf of the members of the coalition or alliance.
So on a follow-up question with that, would there need to be some legal structure within that grant, or to say that the alliance would be covered with that, even though it's not a 501c3?
We would strongly advise a memorandum of agreement or understanding so that we know who's going to do what within the activities, the implementation strategies, and how each one will be compensated, so that we don't have the fiscal sponsor taking all the proceeds and not equitably distributing them as previously agreed.
Mm-hmm. Is this something that happens often, or that people do come together and work like that within grants, or
Not as frequently as probably would be beneficial.
Okay.
You know, it's really hard. I understand with nonprofits, it's hard to share resources. It's tough enough to try to get resources for one organization, let alone 12 or 15, if we're working together as a group. And then there's not always a level of trust. So it works out better when people have been working together for a period of time and they do trust and respect each other. We've seen it work extremely well in cases where there's been that trust. It's only in places during periods where there's not that trust or that basic understanding in the first place that we see breakdowns.
Mm-hmm. Are there systems set up in place where those alliances and trusts can be formed?
Usually it is driven, sometimes it's only driven by one person. Sometimes it comes out of executive directors having lunch together every quarter just as a support group for each other. Sometimes it happens because staff of organizations who make frequent referrals to each other get a great idea, and then they go to their leadership and say, hey, what can we do? Can we do something formal? Or here's this great opportunity. Maybe we should combine forces and go together. So it can evolve in many different ways.
Interesting. Okay, thank you.
You're welcome. Tashaka, am I saying your name correctly? Tshaka?
Her name is Shaka, but she's seeing a patient right now. She sent me a private message and she said that this is her second time coming from yesterday, so she didn't have any direct questions. But Dr. Young, I had to step away, so I'm not sure if you mentioned this, but one of the questions that I received yesterday after our session, of course, was about identifying if you need a fiscal agent and how to locate a fiscal agent and what to look for a fiscal agent. So can you talk a little bit about that if you haven't already?
Sure. So in terms of a fiscal agent, remember, it's probably better to get a fiscal sponsor, but, there may be a way where you want to just have someone access a collector for the funds and then do whatever, distribute the funds accordingly. The important thing, whether you have a fiscal agent or a fiscal sponsor, is that there's trust and there's an agreement. Now, in looking for one, obviously, it would seem that the easiest place to find one would be one of the stronger organizations within your cohort that already meet together. And then obviously having the agreements completed in advance. It would be difficult to just go and create a relationship with someone that you didn't know. However, in some cases, you might want to ask a funder who might be an appropriate fiscal sponsor agent for you. The Community Foundation has done some of that for people in terms of saying, oh, this might be somebody you want to talk to. And, if you do get a funder who's willing to be involved, Assisi has done that. We would help broker the agreement, if you will, so that both parties or all parties are protected. A fiscal sponsor needs to have the capacity to be a fiscal sponsor. So somebody filing a 990N, receipts of less than $50,000 a year, probably doesn't want to go to somebody who is in the same situation. They would want to go to somebody who has assets of greater than $500,000 a year income. So, obviously looking at their 990s, seeing their capacity, making sure that, the staff is compatible. It's like working into, evolving in any partnership. So, I equate it to, there are different levels, like a casual date, a serious date, potential marriage with a prenup. It's kind of like, you don't want to just go on a date with anybody, right? So it's kind of like doing that when you're looking at other organizations. Kim, thank you for being such a great participant and offering ideas and thoughts earlier. Is there anything that you'd like to share?
It's my pleasure, Dr. Young, always. I think both sessions were just excellent. I look forward to the handouts. But I know they'll be very helpful. So I appreciate doing this. Now, one question, I understand that there's additional sessions coming up. So
Yes.
I guess I will, if I sent Aisha, I think my email and all, I just want to make sure that I'll get notice for the continuation.
I think she's got you hooked up, Kim. I think that you're going to get everything now.
Good. Thank y'all.
And, I hope that the state finds whatever coordinating agency soon, Aisha.
Yes, so in conversation with Eddie in our weekly meetings, we're hopeful to have a fiscal agent by the end of May. So, well, actually, I think the middle of May, because we're hopeful to release the RFP in June. So, fingers crossed. We hopefully we'll get that soon. Another question that I had, before we end, because I do realize that we are much closer to the hour than what we were yesterday. There was a question about getting grant writers in terms of how can I say this? finding a grant writer and then paying a grant writer to write grants for you. So, what are your thoughts about that? Is this something that you think is a good idea for them to locate someone to write the grant for them? And how much would you say would be a good amount to pay for that? Or do you think it's probably best for them to make that attempt themselves, especially since they are doing the work and they may just need to get a little bit of assistance with writing the proposal?
I think everyone is capable of writing a grant. I think people, if you're working with a nonprofit, I think you're capable of writing the grant. However, I do think people can be intimidated. People are fearful. People want support. I would call Momentum Nonprofit Partners and ask them, what's the going rate for a grant writer? Grant writers can charge a good bit of money, and they deserve to get paid. They have to do a lot of work in order to deliver the product that you want, the quality of product that you want. It has to be someone who really understands you and can hear what you're saying instead of putting their own spin and interpretation on it. So there are good grant writers out there. There are, and the other thing is, you can't get mad at them. If you say, please write my grant, you pay them and you don't get the grant because it may have nothing to do with a grant writer. The grant writer can present your case in the best way they can, but they can't fix all the things that might need to be fixed with your organization. So, it depends on the capacity of your organization. And I would reach out to board members and say, hey, can you help me? Do you have somebody that that can help me, that doesn't charge me, but will do a quality job? I would even reach out to the university if there's a student who needs that experience and say, hey, is there anybody who would be willing to work with us on this? You might actually want somebody to start working on a grant prior to you even having to write a grant, because there's some basic things about a grant proposal that are consistent. It's kind of like your background and your history. All those, there are basic elements of that. So all you have to do is copy and paste once you get all those things done.
Thank you so much. So if you can, I know we've gotten down to 11. I think we got up to about 20, 25 earlier. You can let us see your faces, your gorgeous faces, and do a hand clap for Dr. Jan Young. She did an amazing job today, bringing us the information yesterday and then adding a little bit more detail for today. We are right at the 12 o'clock hour. So I thank everyone who joined. Especially those who rejoined because you thought it was so good yesterday. And again, we will be sending out the recordings, also the resources that she shared with us on yesterday. So be on the lookout for that in the next couple of days. I hope you all enjoy yourselves, and we look forward to you all participating in our Connect to Protect meeting next week and the next technical assistance training that we'll be hosting soon. So thank you. Have a good day.
Take good care. Bye-bye.
Oh, she hung up today. I thought she was going to stay on and have a little chat.